Hello friends, today I am going to discuss a case of facial asymmetry due to condylar hypoplasia. So, 29-year-old female patient visited our colleague dentist Dr. Rajeshwini Korve in Pune with a complaint of facial asymmetry. So she did the clinical examination and she advised her some x-rays and she shared the x-ray detail with us, and we found that there is some abnormal growth of mandibular condyle on the right hand side, and we advised her to do further investigations like 3D CT face and bone scan, which is technetium 99 scan. So usually we found condylar hyperplasia, which may be unilateral or bilateral. Bilateral is very rare, mostly it's unilateral. The reasons are it may be congenital, it may be because of the trauma, it may be because of some pathology like tumor, osteochondroma. So after we advised her CT scan and we advised her technetium 99 scan, we found that there is a abnormally larger condyle on the right hand side, and there is a still active growth in that condyle with a difference between two condyle of more than 16%. So that is clearly showing that it's a case of condylar hypoplasia and it's still in an active phase, means it is causing overgrowth of the mandible. Usually such growth is asymptomatic, like patient doesn't feel any pain or discomfort, but they notice progressive asymmetry over their face, and which is the primary concern. That is why they visit the medical specialty. So after all these investigations, we found that it was more of a tumorous kind of a growth, more looking like a osteochondroma. So we advise surgery to do a low condylectomy, because there was a difference in the bone height, ramal height on both the sides. So we decided to do like a differential condylectomy, low condylectomy, to make the ramal height symmetrical, and we planned the surgery. The surgery was done in a hospital under general anesthesia, and we performed low condylectomy using a preauricular incision. Patient stayed in hospital for 2 days, and the moment we did low condylectomy and did the closure, automatically most of the time mandible shifts back to the normal position, and many times we found that the facial asymmetry gets corrected by itself. Of course, patient will require orthodontic treatment later on to settle the bite. Because of the shifting of the mandible, there is a bite disturbance which requires braces treatment to correct the bite. So this was like an interesting case, and we got a very good result in this case. So if you have a problem like a facial asymmetry, you should consult maxillofacial surgeon for that. And if you have any doubt about facial asymmetry or condylar hypoplasia, you can contact us on this number, or you can comment on the comment box on this page. Thank you so much.